Hello, this is Joseph Carlson, and this is episode 16 of The Grief of Politics, and I am joined once again by Avin Carroll. Avin, how are you doing?
Doing pretty good. Thanks for asking. Having a good Sunday, I hope?
Yeah, you too. I mean, it's Easter, man. It's, for you, obviously you've been very open. You're religious. You're probably having some dinners. You probably went to church already and stuff like that. I'm doing one of those things and not the other thing. So we have a whole dinner planned. But yeah, it's good. It's good so far. So.
Yep. No, we already went to church, came home, and then we're going to head over to Lisa's parents' place for dinner with her family. And
Good.
Yeah, should be good.
Yeah, so this month, I chose to talk about healthcare. Avin thought we talked about healthcare before. We actually have talked around the edges of healthcare, but we haven't specifically talked about it. But I want to remind everybody before we start the show that this podcast hits every month at www.thegriefofpolitics.com. You can go there and leave a comment below the episode. If you want to write to us, you can write to Avin or I at gwgpodfellows@gmail.com. That way, and also, when you write to us, just let us know what episode you're writing about, because I don't want to delete I want to know what you're talking about or your question or like that. Give us the likes, the subscribes. You can subscribe to the podcast on Spotify or Apple iTunes. You can go to there, leave the comments, the stars, all that kind of stuff. I think on Spotify, you can just leave stars on the actual shows, not on the episodes. I haven't checked my thing on there, and I haven't checked ours, because I will say I checked like a few days ago, and we only had probably single-digit listens, but I think we had maybe one subscriber, but everybody had listened through the episodes. So I guess that's good. But I did not write a thesis for this episode, because Avin and I talked, and I think he said last month that, he's unbelievable. I didn't do that. But I think last month, Avin was pretty prescient in the way he said, I think I know where you stand on healthcare, Joe. This should be an interesting episode. So since everybody knows that I'm a liberal hippie, and they probably figured out where I stand on healthcare, I want to hear your pitch, Avin, your opening statement, what you think about healthcare, stuff like that.
So, first off, I think we should go into the numbers, right? There's something like 47 million Americans or something like that aren't covered on health insurance of any kind. I think that number's as of 2019. So it's a little bit dated, but it's probably gone down, not up, with the efforts of our Congress, with the last president. I don't think that's a good thing, right? I would like everyone to be covered. I think the overall intention or concept of universal healthcare is a great idea, right? We provide police services from the government, we provide fire protection from the government. Why don't we provide health protection? So I think it would be a wonderful thing for us to do. Of course, the New York Times article that you sent goes into this in more detail, so I wanted to read it for the detail, but
to be honest, all I did is sign up for a free account, and you get so many free articles.
It did not tell me I could do that.
Oh, then maybe I subscribed to it for $1 a long time ago and have no idea that I did that, and maybe need to go check through my subscriptions to make sure that I haven't subscribed it. I didn't get that crippling balloon payment that they're like, oh yeah, you can have $1 a month for X amount of time, and then it's $200, whatever. Anyway,
every 3 days.
Check that. Yeah.
So yes, I think it would be wonderful if we could just give everyone health care across the board, and no one had to worry about it. Right. But I think it's naive to think that that's just as easy as turning on a switch. I think we all would agree that even if we did do it, it would take a long time to implement and get it right.
Right.
But also the expense of it, I think, is going to be a lot higher. Here in the United States, we have a very different philosophy than Japan. And since Lisa, my wife, grew up in Japan as a missionary, I think of Japan's universal healthcare system as sort of the one to compare against. But because Japanese culture is a culture of for the greater good and the benefit of everyone, I will sacrifice for myself, universal healthcare actually works very well in Japan. It's probably the best model out there. Outside of your articles, I read a few articles on statistics from Canada because it's what a lot of people compare to, but I also looked at the UK. I didn't have enough time to look at Germany's. and kind of read about the challenges for each one of those as well. And as a libertarian conservative, I don't like the concept of government being in control of any aspect of my life. And I don't like the concept of government dictating to a hospital, like, this is the most you can spend in caring for a person. These are the only options you can choose for providing service to someone who's sick with A, B, or C disease.
Can I slightly interrupt you? Mm-hmm. That's already happening.
With our health insurance companies, yes, not the government.
Right, but then so what's the difference? If you're okay now with health insurance companies interfering with...
I could fire my insurance company and go somewhere else.
You can, but also I think that... I mean, go ahead. We're the opening argument thing. I don't want to, like, derail... Like,
We'll go off on this in a minute.
Yeah, no, and my thing, too, is to say really quickly before I interrupt you again, and I'm interrupting you. I know, that's so meta. I agree with you, right? Like, everything you're saying I agree with. Except for the libertarian part, but go ahead.
You're more libertarian than you know, Joe.
All right, we're going to do an episode on it, because I swear every time you bring it up, my eye starts to twitch, and I'm like, ooh.
So, just the concept of government having that control, right? Like, every single thing the government provides to us makes us more beholden to the government. It makes it more difficult for us to resist the government, to change the government. I've said it many, many times, probably not on this podcast, but you and I have talked about it. I've talked about it with many friends. Every single thing that we give to the government to control in our lives is an abdication of our own power and authority. We are letting go of our individual freedom and giving it to the government to control for us.
Yep.
Because we're lazy, because we're scared, because...
Whoa, buddy.
Because we aren't willing to do our own research and someone else has sold us on a thing. Like, we're giving away our power and authority of our own lives to the government. So doing that with healthcare is scary, right? We've already seen what happens when government controls police. What happens when the government controls your doctors? Now, in Canada, it's a little bit weird. Like, doctors work for the hospitals and then the government pays the hospitals.
Right. And we'll get into that later. They actually, one of the articles I found did talk about our state in Washington State specifically and how they deal with hospitals and how that is a problem. But we'll talk about that later.
And then I looked at the UK, and in the UK, if you're a doctor or a nurse, you work for the government.
So you're just a government employee, basically.
Correct. Okay. And in both countries, they do have privatized healthcare, so people with money can still get privatized care.
Yeah, so you have like the base, like this is your base level of care is government, and then if you want extra, you pay a la carte for whatever kind of coverage.
Okay. Essentially. Which then brings to the other problem, right? Free market capitalism creates competition, which then drives innovation. UK and Canada, they cap how much money pharmaceutical companies can charge for their medications. Guess who pays for it?
The consumer, right?
No, the United States. We pay out our nose to subsidize the rest of the world on their pharmaceuticals.
Well, that sucks. We should get on the subsidy game, is what I say. Then, if we're having to do it for everybody else, we should. I think I agree with everything you're saying.
So these are all like the really big challenges. I would love to see it work, but I don't think anyone has a model that would work in the United States where we value our individual freedom. And we're not very good about setting aside our own wants and desires for the benefit of the people around us, especially people we don't know. Like, we are just not good at it in the U.S. You know that. I know that. Let's just be honest.
That's not something we need bastards. We don't need to litigate that. I think
we're not all bastards, but we
one
are
thing I'll say, so since everybody knows how I feel and I already picked apart your thing, I'm not going to give my opening statement or whatever. I'm just going to go into the first article. It was by the New York Times. Avin couldn't read it, which is fine. Again, I should really check into this because I might have subscribed for $1 for whatever, and then now there's a crippling payment where I'm like, why is the New York Times charging me $200 a month? I don't know. But this article was published on October 16th, 2019. It's called Would Medicare for All Save Billions or Cost Billions by Josh Katz, Kevin Quealy, and Margaret Sanger-Katz. There's a lot of graphs and charts on this, but and I think this goes into your problem where Bernie Sanders and Elizabeth Warren wanted to change in the 2016 presidential election and before that, really, how we think and what we pay for Medicare. I'm just going to read these these two paragraphs.
And if I can-
Quote,
can I
we asked a
interject?
handful of economists and think tanks with a range of perspectives to estimate total American healthcare expenditures in 2019 under such a plan, like Medicare for All. The chart at the top of this page shows the estimates both in comparison and in total cost. There's a lot of charts and they move, which is weird. It just constantly goes through anyway. In all these estimates, patients and private insurers would spend far less and the federal government would pay more, but the overall changes are also important. And they're larger than they may look. Even the difference between the most expensive estimate and the second most expensive estimate was larger than the budget of most federal agencies. So here's part of the problem. They went to, I'm just going to go down here. The estimates come from Gerald Freeman, who's a professor of economics in the University of Massachusetts. Charles Blehaus, he's a senior research strategist at the McCartis Center at George Mason University, and an analyst at the Rand Corporation, which is more right-leaning, so they kind of went across the aisle. They asked everybody, a global policy research group that has estimated the effects of several single-payer health care proposals. Kenneth E. Thorpe, who's the chairman of the health policy department at Emory University, who helped Vermont estimate the cost of single-payer proposals in 2006, and analysts at the Urban Institute, a Washington policy research group. Anyway, they went to several people, and throughout the article, they have charts comparing totals from all these agencies, which I think is good, so you can get the over-under of what it is. It says right here, right now, individuals and employers pay insurance premiums, people pay cash co-payments for drugs, and state government pay a share of Medicare costs in a system like one introduced by Mr. Sanders or another from Representative Pramila Jayapal and the Congressional
Pramila
Progressive
Jayapal.
Caucus. Who is it?
Pramila Jayapal. She's one
Yeah.
of our representatives.
Okay. And the Congressional Progressive Caucus, nearly all of that would be replaced by federal spending. That's why some experts describe such a system as single payer. Some have more modest proposals that would preserve some out-of-the-pocket spending and a role for private insurance. So it's a lot. And they keep bringing up how much. And I just want to read this. So in our current system, doctors, hospitals, and other healthcare providers are paid by a number of insurers, and those insurers all pay them slightly different prices. In general, private insurance pays medical providers more than Medicare does. Under a Medicare for All system, Medicare would pick up all the bills. Paying the same prices that Medicare pays now would mean an effectively pay cut for medical providers who currently see a lot of patients with private insurance. So that's the rub, right? And you were talking about this in your open statement. The government would put a cap on what people would do. You could say, hey, we can only pay this much for this, right? Mm-hmm. But I would like to point out again, like I said in your opening statement, that is already happening. Insurance companies all the time tell people, you and I many years ago knew doctors, and they say all the time, we're not paying for that.
Yeah. Well, I mean, that's just it, right? Like the pharmaceutical companies will come up with a new medication, it's experimental or it's not proven, and the insurance company will say, well, no, we're not paying for that because it's really expensive and it's not proven. So, I mean, was it up until the Affordable Care Act went into place? Like, insurance providers could cap your mental health insurance. So you could only do so many visits in a year, which they can't do anymore.
And I'll say this much, looking at the totals in the article, I'm agreeing with you, like it is nigh impossible to do this. And I think when you were talking about Japan, and I don't know when Canada did it, but I know when Britain instituted this, it was around the end of World War II, I think. And so they've had this amount of time to make a system that works for them. We're starting in, well, we haven't even started yet.
We're talking about starting.
Yeah, we're talking about starting it. So that's the thing is those other countries, in a way, is good because you can look at the totals and what things have cost. Like you said, you were shocked to find out that we pay. I didn't even know we pay for prescriptions in Canada. But one thing they did bring up in this article is
we don't pay for the subscriptions in Canada. We in the United States cover the losses or the lack of profit for the other
Right.
countries where pharmaceuticals can't sell at a profit or can't sell at the margins they want to.
One thing they did talk about in this article that I like is like, I want to see if I can find the exact.
I can't prove that, by the way. This is speculation on just free market and how it works. But
yeah, and that's going to be another episode because, I mean, we're not in a free market. We bail people out all the time when they make bad investments, or some people don't get, held accountable. Anyway, it's I hate it when people. Okay, never mind. I do think it's amazing that they said that. We have helped bring, like you said, we've helped bring down the cost of some medications. And maybe that's kind of an in. Maybe this isn't a thing where we do Medicare for all. Maybe we could do something where we kind of do now, maybe just at a better rate, where if you make under a certain amount, you could be covered by this, you know what I mean? Or you could pass your bill on to the government to help low income people pay. I don't know. And also the idea that we can maybe attack some of the drug prices and bring the drug prices down like we're doing in other countries and stuff like that. Maybe that would be something that would help shoulder the burden of whatever. Or, like you said, in Britain, or I think you said Britain or Canada, if you're a government employee and you're a doctor or whatever and you work for the government, maybe instead of just having Obamacare, we just say, hey, the government's going to have a health plan. And like you said, it's competition, right? So you could say, this is the type of coverage you get with us, and we'll foot the bill. You pay nothing. But if you pay into that, then you pay taxes.
This is sort of, that concept sort of moves into the article about Washington State's single payer system that we came up with, or public option that we came up with. And that brings up, like, hospitals, providers not wanting to accept those programs because, like in Washington State, we're saying, well, we're only going to pay 160% of what Medicare pays. And the insurance providers pay 176% of what Medicaid pays or Medicare pays. And so, what was it, like 20 out of 39 counties or something like that, or like hospitals have taken up the program? But
right. Well, let me just read I'll read the article. We'll bring it in since we're talking about it so much. So this came out in NPR on February 21st, 2022. And it's called "The First Public Option Health Plan in the U.S. Struggles to Gain Traction." And they just happen to be talking about Washington State.
Yep.
And yeah, you're right. So basically what they said is the hospitals are not buying into this. Officials from Washington State Hospital Association said that more hospitals that are not than not are voluntarily participating in public option plans. But they noted that the public option relies on cutting payments to hospitals to control costs and ties reimbursements to Medicare rates, which don't cover hospitals' cost of providing care. And this is, quote, "If patients opt to join a public option rather than a private insurance, over time it would create financial challenges, especially for small rural providers operating on thin margins."
And that was a big problem that was brought up when this was originally brought to the voters a couple years ago, was that the small providers are just going to get crippled by this. What is the article's overall point on this, though, Joe? What is it?
In Washington State, is it that hospitals are basically saying no and that they have to opt in because they're losing money on
So the article's overarching point is Washington State's failing in this was not forcing hospitals to do it. So basically at the end of a barrel saying you have to participate and lose money.
Right. Which I guess is a good way to do it. There was something in these New York Times article.
Every single law you create, you have to be willing to enforce at the end of a gun. Because if someone doesn't want to participate, it could always escalate to the point of violence.
Yeah.
So it's dangerous for government to mandate that. And I think the way Washington State did it is the wrong way to do it. I mean, it is the wrong way to do it, in my opinion. And I do actually like the idea of individual states coming up with their own healthcare options, though, because that's how our country was designed. Allow the states to decide how they want to run themselves. We have moved to a more federal model, and we shouldn't be. We should be moving back towards a more state-centric model, my own opinion.
Yeah, I'm trying. There was one article that kind of blew me away here in the New York Times thing that I can't find now.
So while you're looking for that, I'm gonna bring up one of the things that I found really interesting in one of the articles that I was reading about Canada was that the overall health expense of the overarching expense to Canadians for healthcare for the country is 10%.
Oh.
So that made me
wow.
think, like, okay, so if we paid 10% of our income into a healthcare system, how would that tie up with what we already pay for healthcare?
Right.
And interestingly enough, I pay about 5% of my income towards healthcare, but then my boss pays the other 5%.
Oh.
So if you were to get rid of that expense and then just make it a 10% income tax, how would that translate, right?
I get what you're saying.
So I do actually think that from an economics standpoint, it would be overall more affordable if that's how we did it. But you then end up with zero competition. And our reason for having a failed healthcare system in the United States, and I don't even want to say it's failed, we have some of the best healthcare in the world, it's just not everyone can afford it, which is not good. But, like, one of the biggest challenges in Canada and England in both articles that I read on a pros and cons sheet, one of the cons on both of them was accessibility.
I tried to find a procon.org, one of our favorite sites. I tried to find something on
I found like
but
3
they
different
couldn't.
pro-con articles for both. I'll have to send them.
Oh, really? I must not have been putting
So,
the right search terms in or
Anyway,
whatever.
for both countries, it was accessibility to MRIs and PET scans was super low. Why? Because they're incredibly expensive. And the government doesn't want to spend money on that stuff, so they limit it. And it can be very difficult and time-consuming to get in and get those kinds of scans. In the United States, it can take a couple of weeks.
Right.
Um,
Well, I mean, that's still
maybe
something.
even less.
Yeah, I mean, I don't know. So I did. Go ahead. Go ahead.
So the overarching point, like the failure in any universal healthcare system, is no competition, right? Like you get what you get. You get what the government gives you. And in advanced first world countries, that's still pretty dang good healthcare. In the United States, the problem we have is there is competition, but no one has access to any of the information. So it's not free trade. Like you said, there is no free trade. I don't know what Hospital A, Hospital B, and Hospital C are charging for the exact same procedure.
Yeah, there's no transparency, basically.
And that, in my opinion, is like the biggest failing across the board. If literally all that was mandated by our government was every single hospital, you have to list every single price for every procedure that you do publicly for everyone to evaluate.
Yeah, because it
Pricing
seems like some of
would
that stuff
change
comes
completely.
afterwards. It seems like that stuff comes afterwards.
It all comes
know?
afterwards. You go to the hospital, your insurance company deals with it. So it allows hospitals to charge whatever they dang well please. Providers, some providers will charge half of what another provider will do because they have no clue what their competition charges. There's no free market capitalism in that at all. This is legitimately all behind closed doors, secretive negotiating between different hospital networks and the insurance companies. And that is our biggest problem in healthcare in the United States, in my opinion. But you can't have a free market if you don't publish that stuff.
Right. Yeah, you're right. You can't. So I found the paragraph I wanted to. And here's something that I kind of knew in the back of my head, but they put it in black and white, which I was like, that's right. So they said the complexity of the American system means that administrative costs can be high, which they can. Insurance companies spend on negotiations, claim reviews, marketing, and this is very important, and sometimes shareholder returns. So
Frequently.
we have turned this into a profit center for these shareholders. And I would say that I don't know how it works in Canada or Japan with if you get a bonus or maybe you get extra time off or how that works with their compensation. But I would say this is one of the biggest problems of our system is that there's so much money, there's profit in it, as opposed to care being the number one thing. And again, I don't live in Canada. I don't live in Japan. I don't know how those things are profitable for those people, and there might be some bonuses, yearly, quarterly, whatever. I don't know. But it seems like here, that is the rub, that you're taking away, not from hospitals or whatever, but you're taking away the profit act. Like if the government says, hey, we don't want to make this profitable anymore, is that some of the money? That's another thing that you're talking about. I would like to see what their returns are. And if we pay you this, you're not going to be able to get
any major national hospital network, I shouldn't say any, but a lot of major hospital networks are publicly traded companies. And their financials are publicly accessible because of that. They have to be by law. So you could look it up if you want to. You can see where their margins, their losses, their profits, their salaries, all of that. You can get all of it.
Right.
I have not gone through the effort of exploring it, and this is where we then have the challenge of should healthcare be a for-profit service or should it not?
I have an answer, but go ahead.
You think it shouldn't be, but I think there are severe advantages to being for-profit. There is a profit motive. The problem that we have in the profit motive in the United States is there's zero transparency. We have absolutely no clue, and so none of us can make an informed decision. We can't. One of the bigger cons in Canada and the UK, on both of the articles I read, people don't want to be doctors. There's no money in it.
Right.
Like, so...
Yeah, you go through all that training. Well, that was another thing. I don't know if it was...
No, health... one of the interesting things is getting a doctorate to become an MD in Canada is about half the price of it in the United States.
Wow. We'd have to talk about college tuition. That'd be another episode where we'd have to talk about the price of college. And
but
stuff
one of
like
the things I read in the UK on the con list is I went down into the commentary behind it, and one of the commenters who lived in England said, one of my problems with the healthcare system in Canada is I'm receiving healthcare from interns because the doctors with experience go work for private companies.
Because there's more money in it.
Correct.
Yeah, it's well, that's...
And it's obviously not all, right? Like, a lot of people get into healthcare because they do want to serve and be generous and kind and helpful.
No, that's... And I'm not saying people shouldn't make money or, like, pay for things, but I think
the government should dictate how much they can make.
Yeah.
Okay, Joe.
We do it all,
would you be okay with that if the government dictated to you what you make? I mean, they do in some cases, and for you, it's very
They
generous.
do, Avin. They do dictate what I make. And it doesn't matter if it's a government. My employer already dictates what I make as it is. I'm non-union.
Leave your employer.
Okay. All right. Yeah. That's really easy to just watch. I see you later. I'll get a job tomorrow.
You did, actually. And then you came back because the grass wasn't greener.
Well, they offered me a mess. Anyway, that's another episode. No, I think. Listen, I agree with everything you're saying. It's not without problems, but I think the difficulty I see. I don't want to say problems again. The difficulty I see with all this is we are just like other episodes we've done on climate change or reforms of anything. We're talking about it now. When all these other countries have started the ball rolling years ago, and for good or worse, have worked out some of the things, maybe not worked out. You know what I mean? You hear about prescription drugs being cheaper in other countries. Like, hey, why can't we just get some of that? Like you said, why can't we just maybe pick at the edges and adopt some of these systems, that these other, like, just to relieve some pressure. And one of the articles I think we should bring in now, the last one by, I've never heard of this, but it came up, Health Exec for Leaders of Provider Institutions. And this is just a study, universal healthcare system would save lives and improve healthcare. And this was published by Amy on February 18th, 2020 by Amy Baxter. And basically it just says that there was a study published by The Lancet. The study underscores that despite having the highest healthcare expenditure per capita, the U.S. still struggles with uninsured and underinsured people. Currently, about 37 million Americans are without health insurance, while another 41 million have inadequate access to care, according to Yale researchers who conducted the study. Blah, blah, blah. By contrast, Medicare for All would actually cut healthcare expenditures 13%, or more than $450 billion annually. In addition, a universal healthcare system would save 68,000 lives annually by ensuring access to care for all Americans. And creating a universal healthcare system wouldn't come at a significant cost to taxpayers compared to the current. Anyway, the entire system could be funded with less financial outlay than it is incurred by employers and households paying for healthcare premiums combined with existing government allocations. One of the things they pointed out in... allocation. One of the things they did point out in the New York Times article, which you and I know, we right now are paying for people's health care. Because if you pay into a system and we're not going to the hospital, that money is allocated to somebody who's going to getting medication or going to a clinic or getting service, basically, right?
I mean, we pay for veterans through our taxes. We pay for Medicare.
Well, I'm just saying our insurance premiums right now. You and I are paying on insurance. Maybe we're not going to the doctor, but that money we're putting into that pool or giving to the insurance people is going to other people as they're going to whatever. And, that's wild. It's a big pot right now, basically, So my argument is, okay, we're already throwing it into this one pot. And I agree with you, the government is not perfect at everything. But if they had a system if they had like basic, like you said, like in the UK or Canada, where it's like, here's our basic level of care and this is what we cover, like an HMO. This is what we cover and it's a government plan. You will increase your taxes and this is what you get. And you could go to Kaiser, Blue Shield, and here's the extras. You know, you could get your MRI, like all that kind of stuff. I mean, just to implement that, I'd be like, okay, let's give it a shot. And I tried to look up Massachusetts because I know Mitt Romney, worked on that in Massachusetts, I think in 2006, which I've heard anecdotally was kind of a blueprint for the American Care Act, Obamacare, whatever. But I tried to find like studies to show how that worked, and all it did is link me to their page to sign up for Massachusetts healthcare or look at charts of people from Massachusetts saying it was great, which is fine if people like their healthcare. But I want to see someone from the outside go, did it really work? And I've heard anecdotally and read that when all the conservatives were complaining about Obamacare, Romney was somewhat quiet. Maybe he had some misgivings, but since his state had ran through it before, they had a little bit of a dry run to see what was happening. So it's not to say he didn't like Obamacare from what I read anecdotally, but he kind of knew like, okay, here's the sticking points, you know? Like, so I think that's really interesting too, you know? So, I mean,
from a money standpoint and an efficiency standpoint, right? Like, the fewer people having to work in the system, the more efficient it becomes, right? So, like, right off the bat, the earlier article where they talk about, like, administrative overhead, what was it, something like the healthcare industry is something like 12.5%, but in single-payer systems in other countries, it's like 2.5% or something like that.
Yeah, or 6%, right? Or it's like single digits as opposed to the double digits in the...
one of the articles I'd read talked about... in the Canadian system, providers usually only have one assistant, like a doctor, because they don't have to go through all of the different like medical billing and all the other challenges. One of the things they mentioned in the United States is because we are a for-profit system, like they pay people, medical billing specialists, to find all the different various things they can bill for. So they talk about overutilization in the American healthcare system because hospitals are looking for everything they can bill. Because it doesn't cost you, the consumer, anything, it costs the insurance company something.
Right.
And there are advantages to that, though. Because doctors are more likely to screen for weird, oddball things that are low risk, but they're catching more stuff that way for people that have coverage. Mm-hmm. The expense aspect of it, like, okay, so, you know, if your employer pays half of your healthcare, then we go to a universal system. I don't pay anything. Your employer doesn't pay anything. It just comes out as part of our taxes. What happens to the employers, right? Like everyone talks about like our taxes are going to go up, but would businesses be able to pay higher? Not likely.
That was one of the counterpoints saying that if they're not deducting, it could be a pay raise. They treat it like a pay raise. Like instead of us taking money out for healthcare, we're just going to give that back into. And you could probably do a thing where you put it into retirement or whatever, so it doesn't get taxed. Or
it would be interesting to actually see that. Again, my challenges with it aren't in that aspect of it, but when you brought up like why don't we nitpick bits and pieces and make it work for us by a little piece here, a little piece there, is when you do it piecemeal, you really do make it more expensive for everybody. Because you're not getting rid of any of the expenses, you're only adding expenses.
Right.
So then it becomes a case of haves and have-nots, which is one of the big challenges in England and Canada, is haves versus have-nots. People participate in the government system and they get what the government offers. And guess what? Guess who are the people that get the worst healthcare?
Yeah, the people that are on the NHS, probably whatever. Like.
No. People that live in rural areas because there's not enough money to justify building new hospitals, putting new equipment in, bringing in new doctors. And so they have to legitimately, the national healthcare system in Canada will pay to transport people into larger areas so they can get healthcare because they can't get it in their communities.
I will say this, it's another thing anecdotally. Oh, go ahead. Oh, yeah. Well,
so it actually is more classist.
Well, it's one thing I heard anecdotally was that, again, like people that are in other countries that have access to it.
Actually, I shouldn't say it's more classist because they still get access. It's just hard to
get. You don't have access to like maybe MRIs or whatever. But the idea is that you're like, okay, well, but I have a cough. I could go to the doctor. The problem we have in America is, I don't want to pay. So I'm just going to sit at home with my cough or my ache or my pain. I know something's wrong. I don't feel right. Mm-hmm. I'll just write it out because I don't want to go to a doctor. My insurance, if I have it, sucks. I don't, you know what I mean? Like, it's rough.
Like, if we could figure out a way of balancing it so, like, people that want to keep their health insurance could keep their health insurance and opt out of the tax.
Yeah.
But otherwise it went to, like, I think people would be in favor of that until you start, again, looking at that would make things more expensive for everybody.
Right.
So,
yeah.
It's extremely, extremely difficult because, like you said, you agree on everything I say, and I agree with everything you say. Because the data is there. But how do you make it work? Because it doesn't work right anywhere.
Right. I mean, my thing is, yeah, unless you're incredibly wealthy and could be like, I have one of those devices like in Elysium where I just lay in it and it cures me of all ailments. Like, anyway, random reference.
Or altered carbon, where you just upload.
Yeah, you upload your new body. It's the same thing. I'll say this much. Reading those articles, though, I think I wish I had found the study, but there was a new study that came out that basically said not only from the pandemic, but after the pandemic, Americans' life expectancy is dropping. And I wish I found the data, but I'd like to push back on you that I've read that America doesn't have the best healthcare. We pay a lot, but we sometimes don't get the best care. But I don't know, because I couldn't find the article or the graphs or the studies, if that's because we have more people that are uninsured that do not go to the hospital and that pushes that down, or the fact that we still pay too much and maybe we don't want to go because we pay too much. I don't know.
Well, when you look at it on a national aggregate, right? Like, we pay more than anywhere else in the world, or most of the world, and we have lower outcomes than most of the world. But I would wager that you would find that people that are getting health care through their employers that aren't worried about spending money on it, that are not underinsured, but people that are fully insured in the United States, I would wager get better health care. It doesn't mean we make better decisions with our health. I've also read something recently on the life expectancy in the United States going down, and they attributed it to we are more sedentary. Our diets are continuing to get worse. And those were kind of like the big factors. And then you add stress on top of that, because in America, like, we glorify a hustle culture, work your butt off to make more money and be more successful, as opposed to like having rest, spending time with your family and your loved ones, you know, working to live instead of living to work.
Yeah, and I mean, we've talked about it before anecdotally, like, several people haven't got pay raises, not even before the pandemic. Like, I haven't got a pay raise in several years. And with the cost of gas going up, with everything going up, you have to work. Yeah, I'll do overtime. I'll do another shift, stuff like that, just to pay for it. And they're not even over.
But that's not even what I was getting at. Like, we in the United States are a culture of, like, we started off with lift yourself up by your bootstraps, and the Protestant work ethic is kind of the history of the United States. But we've just, like, lifted it up and raised it up as time has gone by more and more and more. And we idolize people that work 100-hour work weeks, 80-hour work weeks. They're hustling, and they're making more money, but they're killing themselves doing it. I mean, I did that at a former employer when I was working like 60-hour weeks in the slow season and 80 to 100-hour weeks in the busy season.
Yeah, and that's the thing is, I've noticed that too, but as I've gotten older, I kind of get more depressed when people mention that. Like, oh, I got 140 hours on my check, and I'm just like, oh, man. Like you know, like, I can't. Ugh, and
there is the other component of it too, people doing that just to get by, or working multiple jobs just to get by. And that is a different challenge and a different problem. And again, this comes back to free markets. Apparently, Lisa was telling me that in Washington State, we passed a law that requires all employers to post their salaries on job openings.
Oh, that's good.
I thought it was just...
Well, I mean, this is kind of we're kind of getting away from healthcare, but I mean, you've hired people before, and I've read a lot of stuff about, hey, when people say online, hey, if you come in, don't ask about salary. And I remember when I was doing my mock interviews years ago in high school, hey, don't ask. And it's like, that just seems really
and I have
bad.
The polar opposite philosophy. I think you would agree with me too. Like, I think it's just disrespectful to waste someone's time. You go through the whole interview process and then find out they're paying $3 an hour less than you were making at your other job in the same role. Like, you wouldn't have gone through the process. Right?
Yeah.
I don't know why... I mean, I guess I understand why, but I don't agree with the philosophy. Again, I'm a free market person. Like, that stuff should be public and shared because there needs to be competition. Hey,
Yeah.
buddy, like, yeah, you got a great benefits package, but this guy also has a good benefits package and can pay me $2 more an hour or 20 grand more a year or whatever it may happen to be. I'm going over there.
Right.
Oh, well, we'll match it. Okay, cool.
Yeah, and then two, if you're looking at the listing and no one's coming in, you're like, oh, maybe we need to bump up because we're looking at all these other people and they're posting what they're putting, and we need to bump this up because no one's coming in to get the job. You know what I mean? Like,
and again, this goes back to the healthcare argument again. If hospitals and clinics were required to post their charges, even if it was still paid by your insurance company, I think people would still be more conscientious of where they went. And hospitals would be more conscientious because the insurance companies would be like, wait a minute, they're 20% cheaper. Like, you have to go over to that hospital. They're 20% cheaper.
yeah.
And then people will be ticked off because their insurance company is telling them where they can go. Like you said, it's not the government, it's the insurance company. But the hospital that lost all that business is going to go, oh, crap, where can we cut costs?
Yeah.
Hey, executives, you're getting smaller bonuses this year.
Yeah, again, I mean, I don't disagree with you. I think it's just like the climate change debate. This is sad that this is the year that we're like, oh, maybe we should do something about this whole medical thing, you know, like maybe. And there's been grumblings for years. I think really what pushes to the forefront is something we might talk about in another episode, though, which is the unionization efforts happening around where workers want more rights and they want to, like you said, they want everything to be transparent. They want to look at everything. They want to, you know, you want to know what's going on, you know, and with medical, like you said, everything is hidden. So you have absolutely no idea where your money's going until you get the bill. And then you say, why did they, you know, you're probably at that point, maybe if it was severe enough, happy to be alive. But at the end of the thing, you're like, why is this so much? I mean, just to be really personal, when my wife and I went to the hospital when she had miscarriages and stuff like that, it's a terrible situation. I'm glad my wife is healthy and things like that. But when you get the bill, it is a really big slap in the face to know what you went through emotionally, to then see a bill attached to it. Whereas extremely, you're just like, oh, that's another way that we're just going to have to deal with this terrible thing that happened, you know? And it's just like, and I remember one time through all the illnesses that we went through, the time she had the miscarriages and was in the hospital, one lapped over into the two happened basically in the same year. And we had spent so much, I don't know what they call it, like a lot, whatever they call it. There's a term where it's like everything's for free because you spent this much out of pocket and you've
reach your deductible maximum,
deductibles and all that stuff. So they were like, hey, this one's on us basically, or, you know, whatever. And part of it felt good, but then part of it didn't because it was like the third time we'd been through it. And I just made the joke that if anybody needed aspirin, they could just give our name at the desk, and they could just charge the aspirin to our room. Because just give it if you need codeine or any kind of like an IV drip, anything like that, just do it.
Codeine, huh?
Whatever they have at the hospital, man. You just put our name down in the front desk if it's like a hotel, and we'll charge or whatever. No, it's I think, and that's what it is. It's you know, it's the. And I read it a lot, not just about what happened to my wife and I, but anybody that's gone through anything traumatic, not only do you go through the traumatic thing, but then you get the bill. And you're like, oh, like, and then I'm going to be paying this for.
So you had all of the grief associated to whatever happened.
Yeah, your injury, like you were injured, car
your
wreck,
injury, your
whatever.
surgery, your illness, your loss, whatever it is. And then you get a bill and you have to go through all of the stress and grief of paying for the large bill. Right, like, and then, you hear about it all the time. People that get cancer and go through all the treatment, and, you know, even after the health insurance company pays for everything, they've still got $100,000, $200,000 bills. I actually really appreciated the I can't remember his name. Oliver.
John Oliver.
Yeah, John Oliver on his new show where he like went behind the medical billing thing and like showed the back.
Oh, last week tonight.
And bought all of the medical debt and then released it.
Oh, yeah.
Like, I was like...
He did that with student debt, I think, too. That isn't the first... He did it with college debt, too, because it is, like, a weird thing like gambling with college debt where, you know, you're sitting on debt for so long, they will sell that debt to another company for, you know...
Like your mortgage or any other kind of
debt.
debt?
Yeah, like 40 cents on the dollar because they just want to get paid out and close the books. Mm-hmm. And so then he went through, bought up a bunch of debt on college debt and paid it off and was like, now, you know, we sent letters to people saying your debt's been released. You know, we just forgave it.
So on the healthcare thing, there's all these challenges and struggles and difficulties, and I've always wondered, like, in looking at it, like, what is the right solution for it? And I've always kind of dabbled with the concept of, why don't we do it at a state by state level? Why don't states levy healthcare like they do fire and police?
Yeah.
And like go to employers and say, hey, if you guys kick into this, what you're already paying for healthcare, and your employers pay in taxes the difference on that, like, we can cover everybody. And I think we would see a lot better than what we did with the Affordable Care Act. The Affordable Care Act was a poorly written bill. It was a desperate attempt to come up with something and get it on the books, and it helped some people. Like, even for me with mental health, it created some provisions that were really, really useful. But ultimately, the implementation of it, like, the exchanges still aren't that good because companies aren't really offering good programs. They're backing back out of them.
Yeah. Well, yeah, that's the thing I think that bothers me is that I think in a way we had some good stuff there, and it like you said, because it was so long ago, it's like nobody's revisited and said, how can we clean this up? And even at the time, people were like, well, this isn't like a silver bullet. This is more of just a Band-Aid on an already horrible system. And again, one thing I didn't read in the New York Times article is that there's so many different, they're like, oh, we'll just do X, Y, and Z and it'll cost this much, but nobody's come up with a way to pay for those things, which is another big deal of, okay, fine. So you want to basically raise the deficit, or you need X amount of dollars. How are we going to get X amount of dollars? And when you're writing a proposal and you just shrug, that's not really a way to pass legislation in any meaningful whatever, or, there's no. And so,
I mean, you look at Bernie Sanders or Elizabeth Warren, their answer is not like, yeah, we have to tax everybody. Like, everyone's tax load's going to go up. Their answer is, well, tax the rich. Well, you can't tax the rich and cover that. Like, if you tax the rich into death, they wouldn't cover the expenditures in the United States for a year.
Man, I mean, that's probably, I'm going to actually write that down in my notes because I do want to talk about the rich. And I think we'll just call it, I don't know, maybe it will be taxes in the rich. I don't know. But it is a part of contention that, you've seen it. Oh, my mouse isn't working. Yeah, I mean, there's a lot of, yeah, like, let's see.
We should kill them all. I'm being facetious, folks, by the way. I do not believe that.
Yeah, I mean, I don't either. I don't want wealthy.
I wish I could find the article again, but I read an article a few years ago from an economics journalist, and he went in. Now, he's conservative, but he went in and he actually did all of the math, and he was like, if we took all of the money from the top 100 wealthiest people in the United States, we don't cover the the government budget for a year. And we still have to take money from every American. And we've now bankrupt the top 100 wealthiest people in the United States, who now have no money to support us the following year.
Well, that's another that is going to be a completely different episode, because that's to talk about tax rates and things like that. Like, that's totally something different.
We all have to pay for it, and it has to be a social contract. But as I've said before, Americans inherently, not all of us, not everyone, right? Like, this is a broad general statement, but Americans, looking at it from a 30,000 foot view, we're very selfish. We want what we want, and we don't really care how it affects the people around us.
Yeah, I mean, that's true. And I'd like to say, too, me being a liberal hippie, I've been listening to conservative stuff in general. I try to be pretty balanced in what I listen to. You do hear this term of, like, socialism, like, thrown around, which, yes, it is a socialist program to provide medical care from the government to people. But everybody keeps bringing up the USSR in the 50s and Venezuela and all these places, or Cuba. And they always bring up, oh, they've already done this. I have relatives that are from there, and it was terrible back in the 50s. It is not the 1950s anymore. There's a lot of countries out there that have different options of healthcare for different people. And it seems like mostly, if I could have found the data in this article, that they are doing okay. Their life expectancy is good. People are generally
very democratic countries out there that have universal healthcare systems and programs, or single payer systems and programs that work, right? Like I said, Canada and England have some of the world's best healthcare, and everyone in the country gets access to it. But there are huge trade-offs. Like,
right, yeah.
people don't want to be doctors, and so it's difficult to get doctors. So it creates long wait lists.
I mean that's my final statement is like I don't like the term socialist just thrown around over and over again. But it's not that like
I mean, I'm sorry, it just slipped out.
Yeah, it was a slip. You slipped. I get it. It's fine. Every time my eye twitches when you're libertarian, I get it. You got to get me once for that. But no, but the idea is that it could be better, and we know it could be better. Everybody that lives in America is like, ugh, I gotta do that. I gotta go to the doctor, and I'm gonna get the bill. Everybody knows. So like, why don't we do something about it and make it better? But
everyone in America feels that way. No one wants to pay more taxes because we all grumble about what we pay in taxes. And yet, from a world standpoint, we pay some of the lowest taxes in the world. And kind of see some of the least amount of benefit from the taxes.
I was going to say, you get what you pay for, right? We don't we have roads and everything. That's nice. But, lights.
There are things in the United States, like, was it people in the United States, I want to say, like Bill Gates, God, probably 15 or 20 years ago, did an interview or an article where he talked about, like, yeah, we can solve all these problems, but we have to tighten our belt and increase our taxes. Like, we can't keep going in a deficit or it's going to fall apart. And so people keep wanting more and more and more services, but they don't want to pay any more money. And the panacea is always tax the rich. And that just, it won't do it. We all have to chip in. And yes, capital gains taxes in our country give extremely wealthy people ways to get out of paying tax.
For me, it's not, it is tax the rich, but the idea that just like Americans, the rich have access to a lot more loopholes. And so what they should be paying, many of them do not pay. So for me, it's not tax the rich, eat them up. It's like, can they just pay what they owe? That would be good if they just paid something, as opposed to very little. That's going to be another episode. Yeah, but so finishing up, what's your closing? I mean, I guess we kind of went over it. Like, you and I both agree, but it could be better. That's my only point.
I would love to see an actual viable solution that would improve healthcare for all of the people in the United States that don't currently have healthcare, right?
Right.
Where do we find the social contract? Where do we find the balance as a country that healthcare is still good enough that people are okay with it, right? Because that, I think, is probably the biggest challenge, is people don't want to give up what they have because the people that have it have pretty good coverage, and they don't want to move backwards. And a lot of those people are willing to pay more, but they don't want to move backwards in quality. And that's what they see in other countries that have these programs. So how do you maintain the quality, maintain the freedom of choice, but provide care to everyone? And that's where I've kind of come up with the idea of, like, municipal hospitals. Why don't we create localized tax systems where, like, in Washington State, we have state-run hospitals and private hospitals. And everyone in Washington pays an extra percentage on it. And if you don't like it, move to another state. And guess what? A lot of people have moved out of our state because they don't like things.
I mean, a lot of it, too, would just be like roads. Like, I get mad, but I am glad that my nail doesn't get or my tire doesn't get a nail in it or anything. Like, there is work being done on some roads. There could be more, but like when I paint into a road, for the most part, I do see people doing work on roads to improve roads.
Now I can. Seattle.
Oh, it's terrible. Anyway, I don't really have much of a closing thought. I mean, you and I definitely agree that it could just be better. That's all I'm saying. There's got to be a way to make it better. And I think not to rip on conservatives, but this idea that they just keep bringing up socialism, it's like, listen, that doesn't really advance the conversation, because all that people that I listen to anyway in progressive circles are just saying
every conservative is a heartless, evil bastard that wants everyone to die doesn't advance the issue either. And
but what I'm saying is I'm tired of them just saying it's a socialist utopia a la the 1950s, liberal hippie. That's all I'm saying is, like, okay, if you like, you and I are having the discussion, you tell me, it would, like, again, the New York Times brought up, hey, this would cost a lot of money to do this, like an exorbitant amount of money. So
but we already pay an exorbitant amount of money. It just doesn't go to the government. It goes to a health insurance company. Yeah. So how do you balance that, right?
Yeah. To me, we always talk about, like, the lesser of two evils, and this really feels like that situation, because right now insurance companies do overcharge for some things, and they decide your level of care. And if I said, hey, I don't really like the government either, but, like, if they had a comparable healthcare plan, I would be like, okay, let's give it a shot because I've already seen what this other thing can do. I've already been part of this my whole life. You show me what you can do and I can shop after that. You know, after I use your service for X amount of years, I can be like, okay, I've experienced both. What do I want to do now? You know, like competition, like you said. So, but before we go, Avin, do you know what you want to talk about next episode? Have you decided? It is your turn to pick. Have you decided the thing? Do you want me to read over the stuff I've written down that we...
Yeah, because I never have an idea when I'm on the spot, which is why...
so we just did... I'll have to remove that. We did healthcare. We got voter rights, domestic terrorism, you being a libertarian. I just wrote libertarian. I just want to take a shot at you. The war on drugs or taxes and the wealthy.
Ooh. Didn't we already do drugs?
We did...
Marijuana.
We did legalization of marijuana, which, by the way, did you on an update to that episode we did, which I think was last episode, the United States government is voting on to decriminalize marijuana, which would mean, as we brought up in that last episode, that people that are growing it, if it was decriminalized, could go to banks and get loans to run businesses if they grow, if that happens. Now, I don't know if it's going anywhere. I heard some early debates, but I don't know if it's actually progressed anywhere in the House or the Senate.
I didn't read the article, but I saw a headline yesterday that was conservatives are softening up to the idea of psilocybin as a treatment for mental disorders because of veterans.
Yeah, I've heard that as well. I think we brought that up in the marijuana
we
episode.
did. We talked about it. Man, I guess we could do war on drugs. I mean, that's a super interesting one. I think you and I are actually going to be a lot more in alignment in that one, but it's an interesting discussion. If we want to have something a little bit more polarizing, then we could definitely do
I don't want to fight.
Tax on the wealthy. I didn't say fight. I said polarizing.
All right. I mean, I'll definitely, and if we did the tax on the wealthy, I'll do this. So I know what we'll do. We usually do it in threes, right? We always do 3 articles, whatever. So why don't we run... Because this is what's going to be. This is really polarizing, and we're gonna make each other laugh. But polarizing with a capital P. What I would say is we'll pick 3 wealthy individuals because there is a lot to pick from, and then since you're anti-tax the rich, maybe you'll bring an article of like, here's why you can't tax Bill Gates, and I will bring hey, this guy needs to pay his taxes type thing. So like a pro and con based on a wealthy person. What about that? What about that idea?
Yeah, I think that might be a good way to do it. If we pick out actual individuals, I mean, it doesn't cover the broader issue, but we will discuss the broader issue no matter what anyway.
Right. Because so that's what we'll do. So we won't announce it again, obviously, till next month. But that's going to be the structure of the episode. So instead of us just picking 3 articles, we will pick 3 wealthy individuals. Avin will be anti-tax them. Here's what they do. Here's their whatever. And then I will bring hey, we need to tax this person type thing. So it'll be more of a debate, I guess, a point counterpoint type thing.
Yeah.
I think that'd be kind of interesting. Yeah. So is there anything you want to plug before we're out of here, Avin?
Like always, bring up my side business, Your Agent Guide. Passionate about making sure that people have the best real estate experience possible. So if you're anywhere in the United States, I can help you find professional, talented real estate agents to help you in your real estate transactions. It is all free, of course, because I am paid by the real estate agent that you would work with, and you get all the service for free. So if you are interested, check it out on YouTube. Look up Your Agent Guide.
How many videos do you do a week?
I do 1 video a week right now.
1 video a week, okay.
Which I just started consistently doing 1 video a week. But also you've got my website, youragentguide.com. And my passion is just helping people get through it. So even if you have questions, like I'm super happy to help, even if there is nothing on the back end for me.
Yeah, I mean, we've talked about this many times. It's a big part of your life, getting a home and saving money and understanding what's going on. Like you and I mean, you're in real estate, but I know me, the first time out, I've said it many times, I wish there was so much I knew before going into the situation. And there was a lot of surprises like, oh, we're doing that now. Okay, that seems...
And that's the idea,
reasonable.
right? Like get people the information so they can make more informed decisions and be more comfortable going through the process because I know you can attest it is very stressful.
It is very stressful. It is bad. But the only thing I'd like to plug is obviously this podcast, obviously, and Gaming with Grief. That's the one I do every week by myself, where I talk about games and how they deal with grief and death and loss. And to counteract that, I play a lot of like games as a service games. And in a small mini announcement this morning, Marvel's Avengers, which is the best 6 out of 10, 5 out of 10 game that no one's playing. They've had a lot of problems at launch. I like the game. It looks good on PS5. You had to play 50 of the same mission to get a trophy. That was the last trophy I needed to get a platinum. I don't usually platinum games, but just by playing that game, I was getting trophies. And every weekend I would play 2 of those missions a day to try to get the trophy. And I got the trophy this morning because they don't track how many you've done. And so I was literally just shooting in the dark trying to get 50, and it popped after I did the mission today, and I was like, finally I can rest. I don't have to do this dumb mission anymore. So, but the podcast is Gaming with Grief, and it comes out every Monday at 7 a.m. So, but I want to remind everybody, unless Avin, is there anything else you want to say, Avin, or...
No. I mean, definitely check out the Gaming with Grief podcast. I've been on there a couple times. And
yeah, I've been there because he whooped my butt at Age of Empires, which might happen again because he's now on to the difficult AI, which is, I don't know. I don't even... the easy guys beat me, so I don't even know if we're going to play again. Just remind everybody that this podcast is The Grief of Politics. It hits the 20th of every month at 7 a.m. We have our website, which is www.thegriefofpolitics.com. Please go there and leave a comment. Let us know what you think of the show. Or you can subscribe to the show on Apple iTunes or the Spotify. Go there, leave us the likes, the whatever. You can even write to us at gwgpodfellows@gmail.com and let us know what episode you're talking about so that way we don't delete it. And I think you can follow me on Twitter at JustLittleJoe. I don't think Avin does the Twitters. Do you do the Twitters?
I have a Twitter account. I don't even know what my handle is.
I think you are following me. I only have like 10 followers. I'd have to see what your handle is and everything. If you want me to, we could talk about it next episode if you want to put that out there. But I did look. Our numbers are kind of ticking up. I know I said in the beginning it wasn't a lot, but that's more than the 3 we got from before. So thanks everybody for listening to the show. And we will talk to you guys again next month.